Hello everyone and welcome back to the Osteo Physio YouTube channel. Today's video is all about why pregnant women are suffering with carpal tunnel during pregnancy. So there's lots of different reasons why carpal tunnel syndrome can be triggered during pregnancy. One of the biggest things is something called physiologic edema. So as women go through pregnancy, they typically hold a lot more fluid, and there's two main reasons for this. Your adrenal glands are working harder to increase the supply of cortisol and aldosterone, and what that happens is we get a build up of fluid in the body. As well as this, we have an enlargement of the uterus, which massively impacts that fluid flow and blood flow through the body. So it's very common to get slight swelling, so physiologic edema, in the extremities. So although more commonly around the face and into the lower body, you can also get swelling around the wrist and the hand area, which of course could potentially be a trigger or a compressional trigger of your median nerve, which is around here, which would trigger the symptoms of carpal tunnel syndrome. So as I mentioned, carpal tunnel syndrome, are signs and symptoms associated with compression of your median nerve around the carpal tunnel, so around the wrist area. What typically happens when we get a build-up of fluid is we start to get something called dysesthesia or paresthesia, so altered sensation over these three fingers, typically associated with the median nerve. What we can also get is weakness and pressure building around there, as well as pain around the wrist area. Exercise number one is all about trying to remove the fluid and get movement around the wrist area. The most common triggers is when it's static in a position or there's repetitive pressure around the wrist. So the first thing we want to do is start for about 30 seconds just moving the wrist area. It's really nice to get this whole area moving. If we've got the hands up as well, it can help drain some of that fluid. So we want to help to gently move through this area to relax the pressure. So we're just going through that lovely kind of movement through the wrist. 30 seconds one way, 30 seconds the opposite way. And again, remember, you're lifting the hands up as you're doing this. So moving around the wrist, it might be clicking a little bit, we're probably going to feel it, but so important to get that moving. So we're opening up through the wrist area. Lovely. Once we've done that, we want to start to take a bit of pressure off through here. So what we can do with the thumb is start to massage a little bit around the wrist. So obviously being really careful. If it's really hypersensitive through here or really sore, we might struggle to massage, but you're basically following the thumb, the massage out towards the fingers. So you want to help to relieve some of that pressure. So we're softening all through here to take the pressure off around the wrist. If it's still really quite swollen, you can always add an ice pack around the wrist area before we massage. But again, we're just removing some of that tightness to help with that soreness that's building up around the wrist area. Next, we want to stretch around and massage around the forearm area. So with all of these, being really careful because everyone has different sensitivity levels. So you might find sometimes the stretching might feel really lovely, releasing that pressure. Sometimes it might be a little bit too sensitive, and that's where you can vary these different exercises and work what works best for you. And so find out what's best. So we want to start off, once you've massaged the wrist, massaging down into the forearm. So again, it's really nice. You can either get, partners to do this for you, get them to massage the forearms, or you can massage it yourself, moving from the elbow down towards the wrist. You want to start on the outer part of the elbow first, so where the thumb is, up on this side. So looking at the supinators and the extensor tendons and muscle belly, coming down towards that thumb. So you're massaging down, so we want to do like a circular motion for about 30 seconds. And then same on the other side, you can start to massage on the inner part of the elbow as well, down towards, so from the wrist down towards the elbow. So you're releasing some of that tension, because if there's swelling at the wrist, it's very likely that there's going to be pressure and tension up into the forearms as well. Once you've done that 30 seconds, both sides, we then want to do a really specific targeted stretch. So again, we're looking for quality, not quantity. It might be, if it's really sensitive through here, that you have to reduce the stretch and build it up over time. So the first thing we're going to do is we're going to turn the hand over, other hand's going to fix around the wrist, and then we're going to pull the arm out straight. So we're stretching through the supinator and extensor muscles here of the forearm, which of course blend down into the wrist, into the fingers, which can cause obviously a lot of tension and tightness. We're holding that there. So if I demonstrate from the side, turning over, pulling the hand forwards, we're stretching down that way. What we can then do, which is probably going to be a little bit more aggravating, is go the opposite way. So we're going to turn the hand over, holding around the wrist, and we're going to pull it out in front. This is looking at the pronator and the flexor tendons, so you should feel the stretch down through here, pulling into that area. Again, if it's really hypersensitive and you've got a lot of fluid around the wrist, you might want to just reduce the range a little bit because it might be a little bit too sensitive. So we're holding that in that area. I'm going to make sure that we're moving the shoulders back, so we're rotating back, aiming for about 30 seconds. So I really like this because a lot of us, if we're going through pregnancy, we're going to be quite tight through the neck and the shoulders as well. So you're aiming to do this. So although the symptoms are down into the hand, you're thinking about all compression sites from the hand all the way up to the neck area that we want to release. So we're going to do 30 seconds of movement to help with that fluid drainage. And then finally, if I move my hair out of the way, we want to also stretch up into the neck. And the reason why is we think of something called a double crush lesion. So if the nerve's being compressed and sensitized here, it's very likely that it's going to be very sensitive at the other points that it passes down. So where it leaves the neck, over around the chest, around the elbow, down into the hand. We also want to make sure that it's relaxed up through here to release that tension, but also to take down the sensitivity. So what we're going to do is turn the head away, chin down towards the chest, and again, a lot of people, that might be enough of a stretch. You don't always need to do any more, but for some people you want to just exaggerate the stretch, so using the hand just to gently, that's the key word today, gently stretch up through the neck and then relaxing there. So we're going to hold that probably for about 15 to 30 seconds. So we're looking for quality, not quantity, and of course you can repeat on the other side, but it's obviously very important on the side where the nerve's very, very sensitive. And then as you release, gently allowing the neck to relax. If you are suffering with carpal tunnel, with these symptoms, like I say, get it assessed properly first, make sure there's nothing else going on. And I would recommend, as you're going through pregnancy, maybe repeating this once a day until the symptoms start to ease, and then after that maybe once or twice a week to add it into your routine to keep that fluid draining and also taking the pressure off into the wrist.